I'll open with a couple of general comments. I know each of you, as I do, pay very close attention to standing orders. I know it's something that, as we prepare for session, like me, you read through your standing orders. And so it will come as no surprise when you read Standing Order 4A that the Legislative Assembly of Alberta is meant to come back the second Tuesday in February. One of the reasons for that, Madam Chair, of course, is so the government is not required to bring in interim supply because the budget would have ample time to be introduced, debated, and passed in time for the end of the fiscal year, which every year, without fail, like it or not, comes on the 31st of March every year. So this interim supply is interesting in that it's not just 1 month. We're not just going to the 30th of April. We're going to the 31st of May. And so while that may be spun as just some sort of technical thing, don't worry about it, it may be that the minister would say, well, you know, every single time, of course, this government has brought a budget. In fact, we've had to bring in interim supply. And it is certainly a rich tradition that the government they replaced also followed. But I can tell you that from speaking with folks within various departments in the government, it introduces real challenges for them to plan, because it's unclear exactly what their budget's going to be. If you could imagine that you need to plan your activities from the 1st of April 2018 through the 31st of March 2019, but not knowing specifically what your budget's going to be until the 22nd of March, that 8-9 day window is probably not sufficient for ministries to really truly understand exactly what their roles are going to be in the next year. So I am disappointed that here we are yet again debating interim supply. And as I get into my specific questions about line items within interim supply, I just want to make a couple of brief comments here to the minister. While I do appreciate that it is not a straight line and simply taking, multiply by 6, there are differences year over year. Places like education, places like advanced education, of course, have a substantial variation in spending through the year. I respect and understand that, but because there's so little information in the interim supply, it's one line. Advanced education, expense, $469 million. There's virtually, in fact, no information about exactly what is included within there, at least when we look at our supplementary supply, which we have the opportunity to debate this afternoon, and I am enthusiastic and excited about having an opportunity to ask some questions about that as well. There's at least a couple of lines of information of what exactly that money is going to be used for. So I am frustrated that interim supply traditionally has such limited information. And so the lack of transparency there is startling. It does provide the opportunity for the government perhaps to embed and hide some spending increases, some overspending. And there's an awful lot, Madam Chair, of overspending to hide. Because when we look at the third quarter fiscal update issued just scant weeks ago, there's an extra $1.032 billion of spending in the current fiscal year, in fiscal 17-18. There's an extra $464 million over budget in operating expenses, $427 million in general capital grant overspending, and $323 million in climate leadership plan capital grant overspending. We throw around these numbers, billions of, that's $1 billion here, $1 billion there, it's $464 million. That is a tremendous, a remarkable, a startling amount of money, Madam Chair. So with that preface, I will move in to asking the minister some questions, and apologies if some of this may be a bit of an overlap with my honourable colleague who's gone before me. But I'll start alphabetically. We'll start at agriculture and forestry. Now, I understand that a lot of these increased expenditures this year relate to wildfire remediation, and I appreciate that. But of course, the wildfire was in 2016, and this is the 2017-18 budget. And so my question to the minister is, can you just comment specifically on where this $318 million specifically is going to be spent on the expense side, and why it is that we're finding ourselves in ag and forestry so grossly over budget in this fiscal year? Thank you. Ag forestry.
Honourable Minister.
Thank you, Madam Chair, and thank you for the opportunity to speak on behalf of our government. There was certainly a lot to unpack there, so I'll take the chance to respond to a number of them. I think there's certainly a number of reoccurring themes here in terms of some of the challenges, most of it bringing up things that are not new to this legislature or new processes whatsoever. In terms of the budget being introduced in March, it's very traditional within this House to have the budget introduced at that time because of the way that our particular revenue stream is attached to oil and gas. So, in terms of the impact on staff decision-making and the difficulty of doing that, our government has certainly functioned quite well for decades in terms of functioning with budget being introduced in March. They certainly have enough information on where we're going to be able to be quite confident and comfortable with moving forward and doing the work that they do every day. And let me just take a moment to say thank you to all of those who work so hard on behalf of all Albertans in all of our departments across the government of Alberta. They work tremendously hard every day to make sure that we're able to deliver the services that they need in order to ensure that their families have all of the services and supports that they need to move forward. So thanks to all those staff, and certainly know there's always challenges in terms of the direction of government and the legislature brings to them, but they do an amazing job each and every year in working within the structure that has been in place for a very, very long time. Also, in regards to the limited information on interim supply, again, we have absolutely nothing to hide on this, Madam Chair. As is typical in terms of doing this, it's been every year we go through this process and do it, and in just 8 days, and in just barely over a week, every member of this House will have a chance to see the full budget introduced, for an opportunity for all of us to have a very fulsome conversation on that. So I know that myself and all of my colleagues are looking forward to talking about what we plan to do this year in terms of moving forward in the new budget year, in terms of ensuring that not only do we continue to meet the needs of Alberta families and communities across this province, but also that we've worked very hard in terms of ensuring that as we do so, we take every opportunity to do so in a fiscally responsible way. So very much looking forward to sharing that in just 8 days. Another, again, point brought up by the member is around details around advancing the grant funding for the MSI funding. And again, Madam Chair, this is nothing unusual. It's been done in the past in numerous times, and again, there's nothing hidden in it, nothing bizarre. It's just something that's been done by others such as ourselves. And then in terms of agriculture and forestry, wanted to clarify a misunderstanding there, that the upfront grant payments are to AFSC in order to support them, in order to do the payouts that they need to do through their program. So hopefully that was a good start to answering the members' questions, and I know that we are all quite excited, as always, to continue to answer your questions and make sure that we are as open and transparent as possible to help yourselves and Albertans understand the direction that we're doing and moving forward in terms of supporting Albertans and making sure that we do so in the most fiscally responsible way possible.
Thank you very much, Minister, for the answers to those questions. And as always seems to happen, time flies. So I'll jump ahead here. And one of the areas I wanted to ask about, and again, I appreciate that it is not always entirely valid when looking at an interim supply to simply multiply a number by the number of months. However, in healthcare, I would think that probably healthcare, so I can understand where areas like infrastructure, transportation, education type areas would have substantial seasonal variation in terms of when the dollars go out the door. But demand for healthcare in this province, I can imagine, is generally very steady and stable. So when I do my quick calculations on the expense side of health, and multiply the 3.746 billion dollars that are planned to be spent in the 2 months here of interim supply, and I multiply that by 6, I get $22.476 billion. And when I look at last year's budget, the existing budget, we get 21,406. That's a 5% increase. And so I look forward to the minister enlightening us as to how exactly that represents bending the cost curve in healthcare, where I think Albertans have a reasonable expectation that spending roughly 46–47% of our budget in one area would perhaps be an opportunity to find some savings without impacting frontline services. It's an area where, of course, will voice my great disappointment in this government for not finding more ways of delivering high-quality healthcare services, of which I know we do in this province, but doing so in a way that is more cost-constrained. So I look forward to hearing the answer on how it is that health seems to have gone up so much. Thank you.
Honourable Minister.
Thank you, Madam Chair. And Madam Chair, this is one of those situations in which somehow looking at the math and doing that multiplication just doesn't work. I certainly know that in my experience working with women who were in labor, the same thing happened. You know, they would look in early labor and be like, hey, I've been in labor 12 hours, I'm only at 3 centimeters, and think they were going to be in labor for like hours and hours and hours more after that. And I told them, you know, you can't do it that way. That's not the way the system works. And not the way it works, and not the way our bodies work. And and you know, this is very similar, that sometimes, you know, you can look at things on face value and just do a simple multiplication times 6 and make assumptions that are in complete error. And so just as, you know, those women in labor were not going to be in labor for 3 or 4 days based on the math that they were doing, nor can you say that interim supply in any way is representative of what we're going to spend by multiplying by 6. Just like in other ministries, Madam Chair, there are many upfront grants that health has to provide. Health has an incredible responsibility in terms of ensuring that they meet the needs of those the healthcare needs of those right across this province. And Madam Chair, I'm incredibly proud of our Minister of Health and Associate Minister of Health and the work they're doing, along with all of those incredible frontline providers and all their supporters in terms of providing healthcare. But we also have many partnership with organizations right across this province who work alongside Alberta Health Services and the Ministry in order to deliver services. And those partnerships require many grants right at the front of the year, and really thankful for their work. And once again, just want to acknowledge how together we work together to provide the best care we can to Albertans, and we'll continue to move the bar on this and continue to make sure that we deliver the very best health care to Albertans that we can. But Madam Chair, we're certainly not doing that with a budget that would be multiplied by 6 based on what is on the line of interim supply.
Well, thank you again to the Minister. Thank you for your great work helping women in labour. I think this process may be just as painful as being in labour, but unfortunately the outcome isn't nearly as happy at the end. But I do want to dig a little deeper into this whole question of healthcare, because again, and so I appreciate the argument that we can't and shouldn't simply take this number and multiply it by 6. However, what I'd like to understand is when I look at this $3.746 billion for 2 months of operations of healthcare, and then I multiply that by 6 to count for 12 months, that will be for April and May, which is the next fiscal year. So if I was to take those 2 months, calculate that, multiply that by 6, I come up with a number that's about almost $5 billion. When I compare that to what was spent in this fiscal year, 17-18, that's a 5% increase. So that's the math that we have here in front of us. What I'd like to know from the Minister, which is, again, I don't deny for 1 second that the people in our healthcare system are remarkable people and do tremendous work, and I want to be very clear about that. What I'd like to know specifically, though, what is different about healthcare spending in April and May that would make those numbers that much higher. When we see the budget in 8 days' time, will we expect to see a 5% increase in healthcare spending? Because if that's the case, what is already a pretty unlikely scenario of finding a way to balance the budget by 2023 gets pretty much impossible if that's going to be our cost curve. It may be bending the cost curve, but unfortunately it's bending it up. So that would be a real challenge. So I'd like some very specific details of what exactly happens in healthcare spending in April and May that would put these numbers so far out of whack.
Honourable Minister.
Thank you, Madam Chair. And Madam Chair, certainly in my role as being a nurse previously, no more reference to women in labour. But what I can say is it was incredibly difficult because previously what we saw in terms of healthcare spending was an absolute yo-yo. It just depended on the given thoughts of the government and in that particular year what we might be getting. I never knew if I was going to have more colleagues or less colleagues that I got to work with depending on the particular whims of that government. And you know, Madam Chair, we're committed not only to more stable funding in that, but also the outcome of that yo-yoing was an average increase in healthcare spending that was 6%, Madam Chair. So certainly that has been an unsustainable outcome for the health system in this province that has been a long-standing pattern, and we're very committed, Madam Chair, as a government to bending that cost curve. And so, Madam Chair, absolutely, I would say that we are going to bend that cost curve, and absolutely our commitment to Albertans is that we do recognize the need to move forward in a fiscally responsible way and to ensure that we keep those increases within reason. And so, again, I will say how proud I am of the Minister of Health and the Associate Minister of Health and all of the staff for coming up with the very best solutions to move forward in doing so in a way that allows us to actually continue to enhance the health and well-being of Albertans and the work that we provide to them, but also ensuring that we find efficiencies around that. So again, the Minister of Finance was working with finance offices from right across government to forecast the requirements for each department. And so these are based on their expected costs, what commitments they had, and the timing of payments in those two-month period. So absolutely, in no way can it be projected that expenses would be based on 6 times what is 2 months. And I think that has been stated very clearly that's multiplying this 2-month period by 6 months is not going to be reflective of the budget. And once again, in only 8 days, the full entire budget will be available for everyone to look at and to be able to comment on and to have long and prolonged conversations about as we go into estimates and answer all of the very specific questions for the members who choose to have those questions answered. So, again, very proud of the work we're doing to bend that cost curve as we move forward, and looking forward to seeing the fruits of our continued support for the health and well-being of Albertans, and looking forward to having those conversations on budget just next week.
Well, Budget Day, Madam Chair, is one of my favorite days of the year. It ranks right up there with Christmas. It is finance nerd heaven, Madam Chair, and so we look forward to continuing that conversation. I am disappointed that we didn't hear much in the way of specifics, and so I remain skeptical, frankly, that this government has any desire or ability, more importantly, to rein in spending in a responsible way. And to be very clear, when we're talking about reining in spending, we're not talking about massive frontline cuts. I find it, and when I talk to my constituents, very difficult to believe that in a $21.4 billion healthcare system, soon to be a $22.5 billion healthcare system, that we can't find some reasonable and responsible savings that do not impact frontline service. So in my final 30 seconds, I will ask the Minister of Children's Services here perhaps also to comment on community and social services. It appears that our spending, again, has gone up quite substantially in that area. Is there something specific about April and May in terms of timing of payments that would cause that, or in fact, is there increased service being delivered that has caused this cost increase? Thank you.
Honourable Minister.
Thank you, Madam Chair. Once again, I just want to state that each department submitted their requirements based on what their expected costs and commitments and timing of payments would be, and Community and Social Services is no different in that. We all have different expectations throughout the year. There's not an even dispersing of funds.